Well, good afternoon, everyone. Thank you so much for joining us today. I'm Cliff Cullen, Minister of Education for the province of Manitoba. Joining me today is Brent Roussin. He is our Chief Provincial Public Health Officer. Before we begin today, I do want to acknowledge it is Mother's Day, and I know many of us wanted to spend our Mother's Day in different locations under better circumstances. The reality is we've got challenges before us here in Manitoba. But I do want to take this time to say hello to all the mothers out there. I hope you're enjoying your day under whatever circumstances you find yourself. It's been an interesting and challenging 15 months for sure. And as we go through our second Mother's Day under the pandemic, I just want to say hello to all the moms out there on this very special day, and we appreciate everything you do for us day in and day out. Keeping schools safe and open for students and staff and families has been the forefront of our COVID response planning. Our priority has been to have students in classrooms with face-to-face instruction to the greatest extent possible, since we know students learn best in this environment. We also know, however, that the rising COVID numbers in Manitoba are presenting additional challenges, especially to our health system and to the safety of Manitobans. Although schools have not been a source of widespread transmission of COVID, the case counts in our schools are rising, and with increased transmission of variants of concern in larger urban centers and among younger people, our public health officials are recommending additional measures to keep our schools safe and our communities safe and Manitobans safe. Today, we are announcing that effective Wednesday, May the 12th, all K-12 schools in Winnipeg and Brandon will be moving to full remote learning. This remote learning period will last until May 30th and will help protect our students and staff during this period of elevated case counts. This will also reduce the strain on our healthcare system and give our vaccination campaign an even better ability to combat COVID transmission in the community. Students that are moving to full remote learning will still be able to accommodate in-person learning for kindergarten to grade 6 students who are children of critical services who cannot make alternative care arrangements, as long as the children are not required to self-isolate. These schools will also be able to accommodate in-person learning for kindergarten to grade 12 students who are considered high risk or have special needs. For schools outside of Winnipeg and Brandon who are remaining open, additional public health measures will be implemented. For more details on these additional measures and how the move to remote learning in Winnipeg and Brandon will help in our fight against COVID-19, I will turn it over to Dr. Roussin.
Okay. Thank you, Minister. Good afternoon. I'm Brent Roussin, Manitoba's Chief Provincial Public Health Officer. While schools have done an excellent job protecting staff and students throughout this pandemic, we see a great deal of community transmission right now. This community transmission is affecting schools, particularly in Winnipeg and Brandon. And so moving these schools to remote learning will help address some of that community transmission. We need to act now to break these transmission chains. And so while schools in Winnipeg and Brandon will move to remote learning, schools in other parts of Manitoba will be remaining open. Additional measures, though, will be implemented. This includes proactively moving schools to remote learning who have multiple cases, if those cases are not isolated to a single household. Those schools would be moved to remote learning. School officials can require students or staff who are showing symptoms to stay home for 10 days and encourage testing. And so we've seen this as a common theme in many transmission chains where adults or children have mild symptoms, they improve after a couple days, and then they return to their activities, only to continue to be infectious. So those people didn't go for testing, they didn't isolate 10 days, and they started transmission chain. So it's very important, if you have mild symptoms, stay home, get tested as soon as possible, everyone in your home, at home pending results. Extracurricular activities, organized sports, off-site activities are suspended, and this is except for physically distanced walks or runs in the community. No indoor singing or use of wind instruments will be allowed in the schools. Case investigations have shown that some of these cases may have caught the virus in school or spread it to other schools because they, or some of these cases were not caught in schools or spread to others in schools because they're self-isolating at the time. But we just see these rising case numbers in this age cohort and in all age cohorts, particularly in Winnipeg and Brandon, which means we have to take these steps now to interrupt those transmission cycles. So we're going to continue to work with school leadership. We're going to actively monitor that situation. We looked at a number of different data to make the decision to move Winnipeg and Brandon schools to remote learning while leaving other schools open at this time with those other measures that we discussed. So 20% of overall COVID-19 cases are in school-aged children. As of May 6th, there were 574 cases linked to schools in the prior 14 days. And that included 25% increase in staff and a 67% increase in student cases. And like we said, 20% of current COVID-19 cases are in school-aged children. We've seen this increased cases in some of those younger cohorts in this third wave, especially compared to the second wave. The number of schools with one or more cases has been increasing. Last week we had 176 schools. This week 208 schools with one or more cases. Majority of affected schools, roughly 3/4 of the affected schools are in Winnipeg and Brandon. Winnipeg had the most schools in remote learning, 12 of the current 19. If and when it's needed, we'll move additional schools outside of Winnipeg and Brandon to remote learning. We're going to continue to monitor that very closely. At this time, child care facilities will remain open, including sites in Winnipeg and Brandon. Children who are in remote learning for school should not be attending child care facilities before or after school. We're trying to stop those transmission chains. All school care or child care facilities will also follow the additional guidance for schools and that remain open in communities outside of Winnipeg and Brandon. Currently, public health officials are not recommending changes to cohort sizes as there's less evidence of transmission in the very young cohorts. Of course, we'll be continue to monitor this over time. Between the significant restrictions that came into effect today and this proactive measure to protect schools, we believe we can once again bend this curve. It will help us reduce COVID-19 cases in Manitoba, ease that strain that is already present in our healthcare system, and reduce the risk of others becoming ill. I encourage all eligible Manitobans to make an appointment as soon as they are eligible. That age eligibility now is down to age 35, and we see rapidly growing cases in that young age group, 40-49, and in the 30s. So if you're eligible, make that call, go online, and book that appointment as soon as you can. I again would like to wish a happy Mother's Day to all the mothers out there. I very much wanted to spend this day in person with my mom, but the circumstances require us to connect virtually today, and we'll discuss our plans for in the near future when we can get together soon. So thank you, Manitobans, and I'm going to pass it back to the Minister.
Thank you, Dr. Roussin. We clearly understand that these new measures will have a significant impact on students, on parents, and teachers and staff. We want to thank everyone for their resilience and your commitment in getting through this pandemic together. With that, we'll open the floor to questions.
Thank you, Minister. Thank you, Doctor. A reminder to our reporters on the line, you will have one preliminary and one follow-up question. Up first this afternoon from the Winnipeg Sun, Glenn.
Good morning or good afternoon. Glenn Dawkins from the Winnipeg Sun. Dr. Roussin, I know in the past you've been asked about the possibility of moving to remote learning. I guess I have to ask, what changed now? You seem to have been, I don't want to say resistant, but you seem to be, for work of a better word, resistant to making the move that's been announced today. What changed to make this now necessary?
Yeah, and so I think our policy here and in most places were to have schools open for the most part, right? These were going to be the last things to close and the first things to open. And so what's changed is the dramatic increase in cases that we've seen, the dramatic increase in community-based transmission, and once again the strain on the healthcare system. So we know that there's so much benefit from having the kids in school. We know that our education partners have done such an amazing job at keeping those schools safe. But right now, with the level of transmission we're seeing, we have to break those transmission chains. So unfortunately, we're left with this decision.
Minister, can you weigh in on the same question? Why now for the have to make this move at this point?
Yeah, our goal has always been trying to keep students in the classroom for face-to-face learning. That's where students learn the best. And I think up till this point, we've seen very little actual transmission within the school setting. But obviously, the situation has changed with in terms of the numbers, and obviously with the variants as well. So I think we've come to the point where we have to make proactive decisions around safety. Quite frankly, public safety in regard to students, staff, and families. That's the realization we're in. I think it's a proactive measure, and we've seen the cases increase dramatically certainly in Winnipeg and Brandon.
From CBC Radio Canada, Alexia.
Hi to both of you. I was wondering, do you think it's realistic to think that after May, children could go back to classrooms?
Well, we're of course going to be looking at that really closely. By the end of May, we're expecting a lot more vaccine in people's arms. We're going to have eligibility to, very likely to age 12 and up by at some point in May. So I think there's a lot of reasons to still be optimistic. Right now, we need to make this decision, and we'll follow things really closely. And certainly, the hope is that we can get the kids back in face-to-face learning this year. But of course, we're going to have that based on our epidemiology and decide at that time.
And why did you choose not to make this decision for the whole province? Why did you choose only Winnipeg and Brandon?
Yeah, and so again, we want to keep as many children in school as we can. We know the benefits of this, and that's why we've always wanted to have the schools as the last place to close, and will be the first to open. And we discussed some of those numbers. Over 3/4 of these cases are in Winnipeg or Brandon. And really that's where that burden is right now, where we need to interrupt those transmission chains. But in addition to that, those schools that are outside of Winnipeg and Brandon, we do have those additional measures in place. And of course, you're going to be watching very closely.
From CBC Manitoba, Jill.
Good afternoon. Dr. Roussin, what's the reasoning behind waiting and making this announcement today on a Sunday? Some parents that we've spoken to say, why not come out with this on Friday and give teachers and families that additional weekend to prepare for a closure?
So, well, I think things we're discussing things, and really in this last week we've seen quite a dramatic increase, and so a lot of these decisions were had to be made in relatively short order. So we always want to balance that notice, but also we need to do this in relation to what we're seeing with the virus. So this is where we landed. And we're able to give a couple days notice, but it's really that dramatic increase which made us make this decision at this point.
And with respect to vaccines, will the province move to prioritizing vaccines for teachers and students over the age of 12? What are we doing to ensure that this closure isn't prolonged beyond May 30th?
So there has been some prioritization, right? If you look at our hotspots, so teachers living or working in those hotspots have been prioritized. So we encourage uptake there, and then really we're weeks away from all Manitobans age 12 and up to be eligible. So we want to encourage Manitobans to watch that eligibility list very closely, get vaccinated as early as you can. If you have any questions, speak to your healthcare provider. Your primary care physician is an excellent source. If you're having any questions or concerns about the vaccine, do reach out. But the message right now is all Manitobans get vaccinated as soon as you can, and watch that eligibility closely.
From the Canadian Press, Rob.
Hi. Part of the plan for vaccinating teachers was getting vaccines from Montana. Is there anything new on that front?
Brent, I can take that. Yeah, certainly discussions are still underway with our friends and neighbors in North Dakota on that front. Obviously not as easy as one would expect, so I'll just leave it at that discussions remain underway.
Sorry, I meant North Dakota.
Do you have another question, Rob?
Nope, that's good. My other question was answered already. Thanks.
From CTV Winnipeg, Mike.
Hi, good afternoon. I'm just curious. I know a lot of times there's a concern that some of the teachers and schools aren't getting enough notice, and with the decision to make the change midweek, do you feel that's enough notice? Could this have been something that maybe waited till Monday, or was it really urgent that it needs to be done midweek?
Yeah, we want to give everyone that's involved here as much notice as possible. Clearly, this will be a transition. We don't expect this will happen immediately at 8:30 on Wednesday. But obviously, we want to give parents an opportunity to make arrangements. Students obviously will be in the classroom to pick up the resources they need. Some of them are staggered, going every other day, so this provides them that opportunity. And clearly, we've been working very closely with school divisions ever since the pandemic started in terms of being prepared for situations such as this. And I think there was an alert, pretty clear alert on Friday that something was going to happen in terms of potential changes at schools. So once we've been able to firm up what those changes are. Notification is going out today to impacted school divisions. So clearly, that's something that we've been working with school divisions with over the several months, and it will be a transition, obviously, to remote learning over the course of the next several days.
Okay, thank you for that. And my other question is, why? Can you talk to me a little more about why it's so necessary for Winnipeg and Brandon versus the rest of the province? Is it that much more serious in those two areas of the province?
Well, this is where we're seeing certainly the most absolute number of cases. We're seeing trends in this area, and of course, when we're talking about schools, 3/4 of the schools affected are in Winnipeg and Brandon. So right now, that was the important to move at this point. Of course, we have those additional measures for schools that are staying open, and then like always, we're going to be monitoring the situation very closely.
From City News, Alex.
Good afternoon. Thank you both for the time on this Sunday. Just to clarify here, how is it possible that there isn't spread of COVID in the schools? I mean, we've seen spread everywhere. So how is it just possible that there isn't spread within the school system?
Well, there has been spread, right? So we've always said that there is transmission that occurs. It's just much less transmission in the school setting than in the community setting, and that's a reflection of all the great work of students, staff, our education departments. So we do see transmission that occurs, obviously, and then what happens is when you're having widespread community-based transmission, increasing number of case counts within those age cohorts, then you're just going to see more and more cases that are linked to schools. And so this is why we need to end those transmission cycles, take this time now to flatten that curve.
Thank you for clarifying there. And just, quickly as students and staff go to remote learning here, just a simple message you want to send to them at this time.
Well, from public health, like we said before, is number one is thank you. We've been dealing with this virus for quite some time, but able to keep our children face-to-face in school for the most part. And so thank you for everyone's work in that regard. And then a message of optimism. In sometime in May, it's very likely that every Manitoban age 12 and up is going to be eligible for a vaccine. And so we're going to have more and more Manitobans protected, bringing us back to really this post-pandemic world. We have to keep that optimism, even at times like this where things are difficult.
From CHVN, Taylor.
Hi, good afternoon. Dr. Roussin, there are some people, questioning the restrictions, and they seem to be a bit confused about the closures, saying they're unrelated to where cases are coming from. Can you provide more clarity on where you're seeing spread? You said 20% of cases were happening in school-age children, but can you just say how many cases or percentage are coming from specific places like social gatherings versus hair salons, things like that?
Yeah, and so this is the problem when you get widespread community-based transmission. It means it's occurring everywhere. We can't link it to things. And so we do know that, prior to these last couple weeks, the majority of cases were in household or social gatherings. But we've just seen a dramatic rise in cases that we can't link to anything. So this is that widespread community transmission. So it requires us to take that very broad based approach. It means that we need people to limit their contacts everywhere. And so the messaging here is that we're seeing increasing cases, we're seeing increased strain on the hospital system, and so we have to change what we're doing. So we really have to limit the contacts we have outside our household because transmission is occurring everywhere.
And last year with the school closures, a lot of parents had to quit or take time off of their jobs to care for their kids due to a lack of accessible child care. What supports do you have right now for parents to help them with these upcoming closures?
So, I think that the response to this one is that parents who are critical workers are still able to send their kids, kindergarten to grade 6. So very and also very. Vulnerable children are still able to attend school face-to-face if necessary. So these are all part of the plans that education has worked out, through this whole pandemic. These are the plans that they've been working on to try to support these families.
From the Winnipeg Free Press, Timor.
Good afternoon, Minister and Dr. Roussin. This is Timor Durrani from the Winnipeg Free Press. Dr. Roussin, you mentioned that it's a dramatic change in cases which led to this decision today, and you mentioned trends, but that is not a clear enough answer about this massive flip-flop from the Manitoba government, which is still ignoring much of what educators have been calling for, such as prioritizing teachers and childcare staff for vaccines. During this third wave of the pandemic, Public Health first said that Public Health will not be imposing stringent restrictions on businesses and storefronts, even though independent epidemiologists had been asking for that for months. Then on Friday, you did exactly that, but without any modeling data provided. You said the same thing about schools for the entirety of last year, that cases were not coming from schools. Now, why exactly is this happening today with the school year almost over? What exactly has changed, if you could be clear for people to understand?
It would be great to have the luxury of those type of things in a 100-year pandemic. So what we've seen is Public Health has never said we wouldn't impose restrictions on businesses. We've always said we monitor the situation and may have to impose restrictions. So of course we take the least restrictive means and try to keep businesses as open as long as possible. But things change, and so we see the increasing cases. That's changed. We see the increasing demand on ICU during this week. That's changed, and so now we've seen increasing cases in these childhood cohorts and increasing effects on schools. So that's the change. So Public Health is going to respond based on that to protect the health of Manitobans, and so this is where we're at this point. So we're always going to take that least restrictive means. And so there can always be questions about why this day and why not another day. Public Health's monitoring a number of things, taking in a lot of factors, and balancing things. Right? There's a lot of benefit to having kids in school. We all know that. But at some point that balance has to shift, and that's right now in Winnipeg and Brandon.
Thank you, Doctor. That question was good, but it didn't answer my question about vaccines and prioritization. But because I only have 2 questions today, I'm going to ask my second one. Minister Cullen, in your time as Education Minister so far, do you think you've done a good job of representing the interests of the Manitoba education system during COVID-19? Do you think it was wise to wait this long before announcing these measures today when educators have been sounding the alarm about this for months? And are you going to prioritize and help press for them to be prioritized during this time for vaccination?
Well, as Dr. Roussin clearly pointed out, we're in a different world over the last week from where we were prior to that. And obviously, these are very tough decisions, and these decisions are not made lightly. And we rely on expert advice, expert opinion when it comes to public health. And protecting Manitobans and students and staff has always been a priority for our government, and certainly from my perspective of our department. We listen to our educators as well in terms of when we set policy and programs. We rely on their opinion when it comes to education, and we're certainly doing everything we can to make sure that we have safe schools, safe workplaces, and certainly when it comes to vaccination programs. We have a lot of frontline workers across our province that are also looking for vaccination. And we've highlighted these areas. There's been a change in how the vaccine is rolled out, and we're looking at these hotspot areas. And certainly teachers and frontline workers are eligible in those hotspots particularly. And as Dr. Roussin points out, we're at age 35 today. We expect by the end of the month, we're going to be down to everybody age 12 and above. So we're going to get there. But it obviously takes a little longer than we thought, and clearly this third wave is upon us. So we've had to make tough decisions because of it.
From Global News, Marnie.
Hi, Minister Cullen, obviously we noted more PPE for childcare, but are we going to be seeing any additional supports for childcares that could be potentially dealing with an influx because of this, like hazard pay or anything like that?
Well, I won't speak to the hazard pay. I guess that's always something that could be considered. Obviously, we want to make sure that everyone is protected. Right from day one, we've supplied personal protective equipment as per the direction of public health officials. So certainly that will continue. We're asking the daycares to stay open to serve the needs of Manitobans, but if they don't feel comfortable being open, they're certainly welcome to make that decision. I do know there's several thousand vacancies, openings in childcare across the province, so obviously change is coming in the K-12 side. We're hoping we can accommodate people, and obviously there's clearly programs in place that we can direct people to make sure that they have access to daycare as well. So we're making that public as well, and hopefully we can accommodate people that are looking for those types of services.
Okay, thank you for that. And I just want to go back to a question that was asked a bit earlier. May 30th, there's only about 3 weeks of class left, maybe even less for older students. Why not take this through to the end of the school year at that point to give students and staff safety and consistency?
Well, I'll maybe just start from an education perspective. Clearly we'd like to have our students face-to-face learning. There's a lot of things that happen at the end of the year that we'd love to have students in classroom. And as Dr. Roussin pointed out, we're optimistic we can get vaccine into people by towards the end of the month, and hopefully that will provide us a lot better situation than we're currently find ourselves in. So certainly from an education perspective, we'd love to see our students back in the classroom for the end of the year.
From the Brandon Sun, Tyler.
Hello, Dr. Roussin and Minister Cullen. Thank you for taking my question. Between today's news and Friday's announcement of expanded health measures, does the province have any new supports in the works for affected businesses?
I would say stay tuned for announcements over the next day or two on that front. I can add, though, from an education perspective, we did set aside $185 million for restart money for education, K-12. We expect we'll probably spend in the neighborhood of very close to $160 million of that by the end of this school year, and we also set up additional funding in this year's budget for fall for K-12 as well. So we don't think we're going to be fully out of this pandemic in the fall, so we've set aside additional resources for COVID for schools as well.
All right, excellent, thank you. And okay, as for the transmission presently happening in schools, I was wondering, is there any one particular activity or root cause you've been able to discern that has led to transmission within the school setting?
Yeah, so again, the transmission within school settings is occurring much less than it's occurring in the community. So most of the cases that are linked to schools we're finding transmission occurring outside of schools with after-school get-togethers, lots of social gatherings, as well as the activities outside of school. So within school, that transmission, nothing, nothing specific, but again, it's occurring much less than community transmission. The remote, going to remote learning really is that we're seeing increasing cases brought into schools, and so putting increasing strain on those schools, and so this is a very good way to interrupt those transmission chains.
From CJOB, Will.
Good afternoon to you both. I guess this question could be for either of you. Would you recommend parents keep their kids home over the next 2 days if they are able to do so?
Well, certainly from an education perspective, we'll leave those decisions up to parents. I know when we had closures in the past, a number of parents took that option to keep their students at home. There may be resources that students will want to pick up over the next day or two. Clearly, as we go through the transition, I know teachers may need some extra prep time to prepare material as well. But again, we do have our remote learning support center has been operational for several months during this pandemic. It is there to provide support to parents and to teachers. And certainly we've been working closely with school teachers over the last number of months on remote learning, because it is happening already. And obviously we're working towards, in case this particular situation, we did find ourselves in this particular situation. So I think we are certainly prepared for this, and I know it will create extra workload. There's no doubt about that. But we do appreciate what the teachers are going for in this regard, but we want to make sure everyone stays safe, and that's paramount.
Okay, thank you very much for that. And prior to today's announcement, how much notice and consultation did health officials and the government have with educators, superintendents, and others in the education system about this decision specifically?
Well, we have ongoing discussions with educators across the province through school boards, weekly calls, superintendents. We had Dr. Roussin and I just had a conference call with 750 principals and superintendents not very long ago. So we do have regular contacts with educators across the province. Clearly, we sent out a significant warning on Friday to the school boards, to saying, be ready for potential changes. And the decision was made in the last couple of days to go to this, take this process forward, again, to try to protect Manitobans. And I will say as well that it may be lost a little bit today, but one of the areas that we're looking at is any schools outside of Winnipeg and Brandon that have 2 or more cases within their facility are being asked to go to remote learning as well. So that impacts about 34 schools outside of Brandon and Winnipeg that will be impacted by these decisions.
Our final reporter this afternoon from CBC National News, Rafi.
Yes, thanks. Good afternoon. Rafi Bujikanian from CBC National. My first question is for Dr. Roussin. We've seen a lot of doubt or lack of confidence in the public about AstraZeneca. We know Denmark has stopped using it completely, and Canada is now getting enough Pfizer and Moderna shots to vaccinate everyone without the need for AstraZeneca. So how much discussion has there been between medical officers of health across the country about pausing the use of AstraZeneca altogether in Canada?
It's been discussed at many levels, and certainly discussed at our provincial program right now. So, as of right now in Manitoba, we have the eligibility criteria. We're in the midst of a 3rd wave. So for right now, our message to Manitobans is get vaccinated as soon as you can, and get vaccinated with the vaccine that you're eligible for, and whichever one that you can get your hands on. So as of right now, We need that vaccine uptake to continue. We know that these are safe, effective vaccines. I myself received the AstraZeneca vaccine, and so for right now, that's the continued message.
Okay, thanks. And my follow-up is to both Dr. Roussin and Minister Cullen. We heard from Federal Health Minister Patty Hajdu today saying she'll be speaking with her Manitoba counterparts this week on what more the federal government can do to help. What kind of assistance do you think Ottawa can provide, and what will you be asking for?
Yeah, well, from a public health perspective, we'll be in touch and have been in touch frequently with our federal and provincial partners. So I won't speak to any of those specifics at this point.
Thanks, everyone. This concludes our media briefing.